June is Men's Health Month, and here to discuss the importance of putting your health first is Dr. Jwayyed, Medical Director of Buckeye Health Plan. Thank you so much for joining us, Doctor.
Thank you for having me.
First, why is Buckeye Health raising awareness of men's health?
Well, as one of Ohio's largest Medicaid managed care organizations, we are committed to making sure that Ohioans improve their health and maintain their health. And one of the ways we do that is we raise awareness of certain health topics we think would be of interest to Ohioans.
And tell us, what are the risks of men not staying up to date on their annual visits and health screenings?
Well, you're just gambling with your health, and it's an unnecessary gamble. We know from different surveys of men that less than half of men make appointments to be seen by their physicians on an annual basis. And we know that men have said in these surveys that they'd rather do things like household chores, like do the dishes or mow the lawn, than going to see the doctor. And we just want to change those attitudes.
So what is Buckeye Health doing to change those attitudes and make it easier for men to go see their doctor?
Well, we fortunately have segments like this with you to raise awareness of the need to see the doctor on a regular basis. We have a huge network of providers across the state, so you can see providers in your communities. We have care guides and care managers that will help you identify providers and make appointments for you. We have transportation services as well. And then members can also earn rewards for seeing their providers, and they can use those reward points for things like personal items and like healthy foods.
And aside from going to their doctor, what else can men do to stay healthy?
Well, for men and women, for all of us, right, it's important to maintain a healthy lifestyle, and that basically includes eating right, eating a healthy diet that is low in fats and carbohydrates, high in fresh fruits and vegetables, maintaining an exercise regimen of maybe 2 to 3 hours a week of aerobic exercise, smoking cessation, vaping cessation, right, alcohol in moderation, and generally maintaining good mental health attitudes and skills. And we know that about 20% of Ohio men suffer from depression and anxiety, often related to stressors related to work or personal relationships, and there's effective therapies for those.
All excellent points. And as you said, health is more than just physical, but taking care of your mental health as well. And today we see men of all ages struggling with their mental health, yet it is rarely talked about. So tell us about the challenges of mental health that men face.
Correct. So health is not just physical health, it also includes mental health. If you see your physicians, you can be screened for things like depression and anxiety, substance use disorder. We know from statistics that about 20% of men in Ohio suffer from depression and anxiety. We also know that men are much less likely to seek care for depression or anxiety or substance use disorder than women. And at Buckeye, we have a huge network of providers that are able to provide services for these conditions in your communities. So there's no reason not to get help. So we encourage folks to get help.
And tell us more about how Buckeye Health helps people address their mental health.
So we have case managers and we have care guides that will help you find providers, help you make appointments. We have transportation services. We have a 24/7 hotline that helps answer questions for you. So we encourage folks to take advantage of those services.
Well, thank you for showing us how we can take care of our health physically and mentally. And for you to learn more information, please visit the website on your screen.